usually take patients around to these different areas to show them what their options are. And we end up, recommending maybe just a few products depending on the patient's experience level, how much they know which product works for them. And we spend as much time as needed with each patient and give them the opportunity to tell us how we're going to be able to help them, really. It's a patient-focused experience. We see a lot of pain patients just with chronic pain. It could be nerve pain, arthritis, stenosis-type pains, and then also a lot of PTSD patients, as well as inflammatory bowel disease patients. It's hard to say the ideal patient because it works in different ways for a lot of different people.
There's a broad range of things that cannabis can treat, and they're learning more about the plant every day. One of the difficulties in running any type of cannabis business is we haven't been able to do research, peer-reviewed research in the United States on cannabis because it's been prohibited since the 1930s. So we have to rely a lot on Israeli studies and studies from Canada and a lot of anecdotal evidence, lots of patient journaling to figure out what their particular responses to medication are. It makes it a little bit more challenging for us to really dial in, but that's why we focus on that individualized experience with the patients.
Most common product is probably the tinctures we use for patients. It's great for elderly patients and patients that are just starting on cannabinoid therapy, that we can slowly work our way up, start low and go slow, and find the right dose for patients. Your body processes these cannabinoids in different ways. The different ways that you ingest it is how we can tell what it's going to do to you or how you're going to experience it. So we know tinctures, capsules, vaporizing is going to have different effects, different onset of action, different length of action. And that's how we tailor an entire approach for somebody. We say, hey, this is how quick this one's going to work. The capsule is going to last the longest, but it's going to take a couple hours to feel the effects.
These are disposable pens, so they're already pre-made, or you can purchase them with these cartridges and then you get a battery. Similar to the packs, which is also a battery. The bottom part's a battery and that top part is the cartridge. And packs is interesting because it has an app that goes along with it. You can dose pretty specifically. It will give you a temperature setting.
We have products that are high in THC and others that are blended or high in CBD that won't cause any intoxication at all. So there's a lot of range and a lot of different types of products that we can use for patients. And this is where a lot of it comes from, is the oils, the extracted oils from the cannabis plant.
It's a miracle plant for sure. It really is a miracle plant.